How is COVID-19 affecting mental health?
But if you have like underlying anxiety and depression, it does exacerbate it because of the physical distancing that is being that we're trying to practice to kind of keep everybody healthy in our community. But I think the thing you want to keep in mind is physical distancing does not equal social isolation. So, it is important to still go ahead and maintain the social connections, reach out and check in with your family members, your neighbor, whoever it might be. So it's a matter of maintaining the social connection so that you are not isolating. But I think it is also, goes back to that whole prevention and early intervention aspect of it, just being more mindful of how you're behaving, how you're interacting, what you're feeling, and then make sure you reach out and ask for help. We have the local crisis line available. The state has instituted a support line for people to talk to a mental health professional if they're feeling overwhelmed with anxiety and depression. There are other support lines that are available in the community for substance use or support, or there's a NAMI online support groups and other resources in place. So we're hoping that people are able to tap into those resources to kind of help manage them, so that it's a matter of you managing those symptoms and the disease as opposed to the disease managing you.
What is the Panhandle Behavioral Health Alliance?
So, Panhandle Behavioral Health Alliance is a collaborative entity. It's a group of stakeholders that has been coming together, has been gathering its momentum over the past few years. We have a shared vision for what we want to see happen to improve our community's well-being. And the shared vision that we all have, focuses on four areas. One is focusing on prevention and early intervention, making sure we address stigma reduction so that people, that's not a barrier for people to seek care. And then when they do decide to seek care, they know where to go to get those resources or how to go about accessing those resources. It's also a matter of community education so that they know how to help themselves and their neighbors or loved ones. The other two focus areas are integrated care. This one, we focus on integrating both physical health with behavioral health so that they're not two separate entities for you to think about. It is, when you think about health, it includes all of you, not just below your brain. So it's a way to see how we can first address that in the primary care setting, because initially when you get sick, your first option is to call your primary care doctor, your pediatrician, or whoever else is serving that function. So we're trying to see how we can enhance that capacity and provide them with the resources and the education so that they're able to manage some of the things that may be situational or some of the more mild to moderate issues related to mental health within the primary care setting. The fourth one involves the justice-involved population, where we're trying to address coordinate and align activities so that there's improved diversion and treatment and continuity of care for those individuals in the justice systems.